juruterapi pergigian.
Saya pembantu pembedahan pergigian.
Saya, juruteknologi pergigian.
Saya pemandu.
Saya seorang pelajar. Seorang ibu.
Ayah.
Seorang abang.
Kakak.
Adik. Saya seorang yang penyayang.
Saya menepati masa.
Bijak.
Aktif.
Ceria.
Saya kelakar. Saya adalah apa yang kamu lihat.
Atau tak nampak.
Tetapi anda tidak tahu apa di sebaliknya.
Sesuatu yang saya tak kongsikan dengan orang lain.
Tak mahu orang tahu.
Bila saya sendirian, tidur sepanjang hari.
Dan mungkin berat badan saya bertambah.
Atau berkurang.
Kenapa lelaki tak ada masalah berat badan? Saya rasa dunia ni gelap.
Sangat gelap.
Saya jadi kerap makan.
Saya jadi kuat merokok dan selalu marah.
Lakukan apa saja untuk kurangkan beban fikiran.
Untuk hilangkan kesedihan.
Untuk gembirakan diri.
Apa saja yang boleh membuatkan diri saya rasa bermakna?
Saya hanya mahu pejamkan mata.
Untuk dapat rasa sesuatu.
Kerana depresi bukan mainan atau alasan.
Atau sekadar hari yang malam.
Ia adalah penyakit.
Saya tak mampu keluar dari masalah ini.
Rasa seperti lemas.
Kadang-kadang saya rasa kamu semua lebih baik tanpa saya.
Saya beritahu perkara ini ke semuanya
Sebab saya perlukan bantuan kamu.
Kerana kamu adalah isteri saya.
kawan saya.
Suami saya, guru saya.
Bos saya.
Jadi, tolong jangan hukum saya.
Abaikan saya.
Buang saya.
Jangan putus asa dengan saya.
Selama mana yang saya perlukan.
Tolong sabarlah dengan saya.
Hanya kerana kamu tidak melihatnya, tidak bermaksud ianya tidak berlaku.
Kadang-kadang kita rasa bosan dengan rutin harian. Kerja dan amanah makin bertambah. Beban menjadikan diri mula gelisah. Bebanan bertambah dan emosi terganggu. Keluhan dan tangisan sering menjadi peneman. Malang bertimpa datang pada waktu tak diduga. Akhirnya menjadi punca kepada kesihatan yang terjejas. Tinjauan Kesihatan Morbiditi Kebangsaan 2019 melaporkan 5 juta rakyat Malaysia mengalami masalah depresi. Apakah ada sinar menanti untuk kita? Stres atau tekanan boleh dikawal atau dikurangkan. Tips 10B berikut adalah langkah untuk mengawal stres atau tekanan anda.
Anda boleh mencuba langkah-langkah berikut untuk menangani tekanan. Bertenang. Bernafas dalam-dalam. Ibadah. bercakap dengan seseorang? Berurut? Berehat dan mendengar muzik? Beriadah? Bersenam? Berfikiran positif? Berkata, relaxlah.
Relaxlah.
You wanna put a ring on my finger? Put it on and make him wanna marry me. Yeah. Put it on and make him wanna marry me. Yeah. Put it on and make him wanna marry me. Yeah. Put it on and make him put it on and make him put it on and make him wanna marry me. Yeah. Put it on and make him wanna marry me. Yeah. Put it on and make him wanna marry me. Yeah. Put it on and put
C'è la luna, mezza mare, mamma mia, mi maradare. Figli mia, cutterare, mamma mia, pensaccia tu. Sitte ogni pisciaolo, ite va, ite viene sempre baccalare del manedene. Se ci picchia fantasia, baccalare, figli mia. Oh mamma, la 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 la. Oh mamma, la 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 la. Mama dear, come over here and see who's looking in my window.
do ba 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 do boo do a boo ba do ba do boo boo ba do a do ba do ba do a do ba do ba do 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 a do ba do ba do a do ba do ba do ba do ba do a do ba do ba do a do ba do ba do ba do a do ba do ba do ba do ba do a do 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 a do ba do ba do a do ba do ba do ba do ba do a do ba do ba do 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 ba do do ba do ba do ba do ba.
Tapping. Mechanism in dentistry.
Untuk kemaju sampai nada tiap sebentar Tunjuk nunjuk baru bela berketir boyfar Con tim sẽ không phụ chung đôi nhìn một cái lạnh băng còn đâu nó vẫn quen quen làm
Created using Powtoon.
Birds don't just fly, they fall down and get up. Nobody learns without getting it wrong. I won't give up, no, I won't give in until I reach the end, and then I'll start again. No, I'm on the lead, I wanna try everything, I wanna try even though I fail. I won't give up, no, I won't give in till I reach the end, and then I'll start again. No, I won't leave, I wanna try everything, I wanna try even though I fail.
C'è la luna, mezza mare, mamma mia, mi maradare. Figli mia, cutterare, mamma mia, pensaccia tu.
널 보니까 네가 널 보고 있음 음악이 baby 너를 위한 멜로디 yeah 네가 늦으니까 잘 들어봐 play it 널 보고 있음 음악이 baby 너를 위한 멜로디 yeah 네가 늦으니까 잘 들어봐 play it baby 네 덕분에 쏟아지는 아이디어 가뭄에 비오던 네가 내게 있어 pressure 조금 섰던 내 표현 노래 들려 give you love 모두 너 향해 love 따뜻함을 느껴 네
Nope. 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 Nope.
When marimba rhythms start to play, dance with me, make me sway. like a lazy ocean hugs the shore. Hold me close, swimming more.
How I cope with stress as a dentist. 1. Hiking. 2. Playing badminton. 3. Hang out with friends. 4. Go short vacay with friends. 5. Spend time with family. 6. Read favorite novels or books. 7. Food hunting. 8. Big favorite cookies. 9. Enjoy the beauty of nature.
mencari timba si anak dara di bawah sarang burung tempua. Salam sembah pembuka bicara, selamat datang untuk semua. Assalamualaikum warahmatullahi wabarakatuh. Saya Raja Nur Adilah selaku pengacara majlis pada hari ini ingin mengucapkan selamat datang ke program Smile 2.0 2022. Sepanjang minggu ini anda akan disajikan dengan CD forum dan webinar di mana kami mengetengahkan isu berkaitan kesihatan mental dengan tema Mental Health for Dental Wealth bersama barisan panelis yang istimewa yang diundang khas bagi program ini. Tanpa melengahkan masa, majlis mempersembahkan kepada anda forum yang pertama bertajuk It's Okay to Not Be Okay. Soalan-soalan yang ingin dikemukakan kepada ahli panel boleh dikongsi bersama di ruangan chat YouTube Live. Dengan itu, saya menjemput yang berusaha Profesor Madya Dr. Budi Aslini selaku moderator bagi forum pertama ini. Dipersilakan.
Thank you, Dr. Raja. Assalamualaikum and a very good morning to everyone here with us on YouTube live streaming. Welcome to the Smile 2.0 UITM webinar series, which is brought to you by the first year postgraduate of dental public health students and by the Faculty of Dentistry, University Technology Mara. For those who are only joining us for the first time today, SMILE is an acronym for the words Selamat, Masyarakat, Ideal, Lancar and Equity, which represents the aspirations for our oral health care, which is to have a service which is safe for the community, running smoothly at an optimum capacity and ideal capacity whilst promoting equitability. The SMILE 2.0 campaign is a continuation of SMILE campaign which was first launched last year with the theme Senyum Bersama Senyum Selamanya, which discussed issues regarding the new norms in oral health service in Malaysia amidst the COVID-19 pandemic. This year, SMILE 2.0 aims to create awareness and to disseminate up-to-date information on the importance and impact on mental health for the dental profession and to discuss possible coping mechanisms for the dental fraternity. SMILE consists of a series of webinars, a comprehensive website on pertinent information surrounding issues on mental health and oral health, a few mobile apps developed towards the same aim, and more than 30 TikTok videos on stress coping mechanisms. This program is organized in collaboration with our strategic partners, the Core Kesihatan Diraja Malaysian Armed Forces, the Malaysian Association of Dental Public Health Specialists, the Malaysian Dental Association, the Malaysian Private Dental Practitioners Association, the Malaysian Dental Therapists Association, Kesatuan Pembantu Pembedahan Pergigian Malaysia, the Malaysian Dental Students Association, and UITM Dental Students Association and BookDoc. This program is also supported by the Oral Health Program, Ministry of Health Malaysia, and is being sponsored by GlaxoSmithKline Malaysia and Colgate-Palmolive Berhad. This year's program, themed Mental Health for Dental Wealth, is hoped to serve as a platform for intellectual discourse amongst the dental fraternities and for sharing knowledge and disseminating information to the professionals and auxiliaries as well as to the general public regarding the importance and impact of mental health in dentistry and also possible coping strategies. Before we proceed further, please allow me to introduce myself. My name is Dr. Budi Aslini Muhammad Sabri. I'm a dental public health specialist and a lecturer in the Faculty of Dentistry in University Technology Mara. And today it is my privilege to host this morning's forum titled It's Okay to Not Be Okay. I'm very pleased to also welcome our three distinguished panelists who are titans in their respective fields to share their thoughts, expertise, and insights regarding the issues surrounding mental health in general and in dentistry specifically. Our first panelist is Associate Professor Dr. Amir Sidek Ahmed Nordin. Dr. Amir is an Associate Professor in Psychiatry and a Consultant Psychiatrist with University of Malaya. He is also an Adjunct Professor in Public Health with the Universitas Airlangga Surabaya in Indonesia. He obtained his undergraduate and PhD from the University of Otago, New Zealand, and completed his housemanship and psychiatry specialization in Malaysia, obtaining his master's in psychological medicine from University Malaya. His main interests are in general psychiatry, especially mood disorders, and he is a subspecialist in addiction, particularly smoking cessation. His research work is primarily on tobacco control, mainly in assisting people to quit smoking. He practices in both University Malaya Medical Center and University Malaya Specialist Center as a psychiatrist apart from his administrative duty as the director of UM Cares. So welcome, Associate Professor Dr. Amir.
Hi, Dr. Budi.
Hi, good to have you back with us again. Our second panelist, Professor Emeritus Datuk Dr. Wan Muhammad Nasir bin Wan Uthman's career in dentistry started in 1976 as a dental officer at a government dental clinic in Kota Baru, Kelantan. His last post prior to mandatory retirement in 2006 at the age of 56 was as the Director of the Oral Health Division, Ministry of Health Malaysia, cum Registrar of the Malaysian Dental Council. Soon after retirement, he was invited to be the founding dean of the Faculty of Dentistry, University Science Islam Malaysia or USIM. And later he continued in the field of dental education and currently serves as an academic fellow at USIM and also as the adjunct professor at the Faculty of Dentistry, UiTM. He was conferred the title Emeritus Professor by USIM in 2015, and his research interests include program development of oral health, education of health personnel, and oral health related quality of life. So thank you, Prof, for joining us today, this morning. We look forward. Waalaikumsalam. Okay, and last but definitely not least, it gives me great pleasure to introduce Dr. Ahmad Rostam, who is a consultation liaison psychiatrist and the current honorary secretary of Malaysia Psychiatrists Association. He has been working in the Psychiatry Fraternity of Malaysia since 2009 and has the experience of working at 9 different psychiatric departments in Malaysia and Singapore. Dr. Ahmad Rostam is active on all media platforms, giving talks, live interviews, consultations, and as a speaker in forums regarding advocacy and literacy on mental health in this country. Dr. Ahmad Rostam can be found on all social media platforms, whether as he himself or as part of health-related NGOs such as Treat My, Medical Mythbusters Malaysia, and Papisma. So welcome, Dr. Ahmad Rostam. Okay, ladies and gentlemen, mental health has a great impact.
Everyone. Thank you so much.
Thank you. Okay, ladies and gentlemen, mental health has a great impact on individuals and society. The conditions are always chronic in nature, and the stigma around mental health worsens the situation. Lack of incentives in terms for the health professionals working around the clock and the poor support systems actually puts healthcare workers at risk of mental problems. Particularly among the dental fraternity, their relentless sacrifice for safe and optimum patient care sometimes put their own health at risk. And furthermore, amidst this pandemic, the dental fraternity is also exposed to additional uncertainties, which include financial hardships, challenging work-family balances, exposure to increased risk of getting COVID, and stretched workplace relationship, and sometimes even being isolated from families due to possible infections can actually affect their mental health. Without much needed attention, the condition could progress and prove costly to individuals, society, and most importantly, the healthcare system itself. Hence, this SMILE 2.0 program is proposed to increase the awareness and knowledge in regards to the importance of maintaining mental health among the dental fraternities in Malaysia. Now, before we get ahead of ourselves, I think it's important that we get down to the basics. So, without further ado, Prof. Amir, could you probably start the ball rolling by helping to define for us the term mental health and mental illness, perhaps? And also, I think it's also interesting if you could tell us a bit in terms of what is considered as politically correct in terms of usage of the term mental health for us today. Thank you.
Well, thank you very much, Dr. Budi, for the kind introduction and also for inviting me again for SMILE 2.0. It's always a pleasure to be here with colleagues in dentistry, even more so when I don't have to talk about tobacco control for a change. So that's something definitely different. I was really hoping that Dr. Rostam would be the guy that should shine the light on at the very beginning, but apparently it has to be me. So we'll have these really tough questions coming our way. In fact, Dr. Budi, when you said that Dr. Rostam is also known as, I was thinking like, wow, he has an alter ego that seems to be happening as well that I was not aware of. But apparently, it's he was just sharing with you that you were just sharing with everyone that he's in multiple social media platforms. And then if you're not following Dr. Rostam, for those of you out there, please do. Yeah, he's got a lot of interesting advice, which we hope to be listening at today. So, thank you again, everyone, for this amazing effort in promoting mental health. In fact, over the weekend, I was with the Green Ribbon team talking to young people about the role of advocacy. And I think it's really important that we're seeing this happening right now in the dental fraternity. And in fact, it reminds me of a book that I was reading by David Enoch, which is about psychiatric issues in dental practice. And I remember talking to Dato Zainal at some point many years ago when we were talking about the TMJ joint and manifestations of various psychiatric conditions in dental patients. So it's not something that is foreign to you. However, as you've rightly mentioned, as a result of the pandemic, we've had a number of cases coming forward. And I suspect that most of our colleagues in the medical fraternity, including dentistry, would probably be seeing some individuals struggling with mental health issues. So when we look at the term mental health, I think first of all, let's go to the definition of health, whereby based on the WHO, you will require three components of well-being. The normally discussed one often is going to be, of course, physical well-being. The less discussed one is going to be social well-being, and the often neglected one is going to be mental well-being. In fact, I dare to say that prior to 2020, most of us were probably not so bothered with mental health issues. Now in 2022, all of us are probably, at least at some point of our last 2 years, have experienced a mental health issue per se. So if you're thinking about mental health in general, it is the ability to actually do a few things. Yeah. First of all, it's the ability to handle stress very well. It's the ability to work productively. It's the ability to, be able to deal with your emotions well. And finally, as a result of having good mental health, you are then able to reach your full potential. So everyone has mental health within them, and it's our role to actually protect that mental health. Now, when does it become a disorder or a mental illness is when you don't have the ability to function. And that functioning would be seen not only in the term of work, for example, but also as members of society, whether you are a parent to children, whether you are a spouse to another person, whether you are actually a child to their parents. And of course, if you're looking at from the context of work, whether you are able to function as an employee within your organization. And finally, of course, as your role in society, whether you're able to actually give back to society at large. So individuals that are struggling with an emotional or psychological issue where there's no physical basis, and I think Dr. Rosta would probably share a little bit more about this, because this is where there's an interconnection between the physical health and the mental health. But individuals that don't have any physical contribution towards their inability to function might more likely than not struggle with a mental health issue. And as we defined just now, individuals that are struggling with a mental health issue are unable to do things that we would expect them to do. However, once the functioning has gone to its absolute level, then that person would be considered to be struggling with a mental illness. Now, we know that generally, as a result of the pandemic, we've all struggled with mental health issues, whether it is stress, which is the most common mental health issue, whether it is sleep, the second most common mental health issue, but a subset of us might have struggled with a mental illness. So it's really important for us to take note that many might struggle with a mental health issue. In fact, based on studies, 1 in 3 or 3 in 10 individuals prior to COVID were reported in Malaysia to be struggling with a mental health issue. That number has jumped to probably 1 in 2 as a result of COVID, but a very small subset, a consistent subset, are dealing with mental illnesses, which I think really needs to be stressed further.
Okay, thank you very much, Prof. Amir, for that explanation on what is considered as mental health and mental health problems. You mentioned, I think, very rightly about how mental health, in terms of the definition of health, that it is the one which is most neglected as opposed to, let's say, physical health or social health. And I think one of the reasons is mainly because it is something that, in terms of when you have problems in terms of physical health, it's something which is tangible, that can be seen, as opposed to mental health, which is most of the time it is unseen. And I think that contributes to why it is being neglected. But on top of that, I think there, in terms of being physically ill, is more acceptable as opposed to having mental problems, and there's some stigma surrounding mental issues. Would you like to comment a bit on that?
Yeah, well, I think some is a very interesting word. Probably a lot of stigma is still being contributed. Before, again, prior to 2020, probably the discussion about mental health among colleagues is probably at its nascent, if not present at all. Yeah. However, now it's highly popular. I think Dr. Rostam particularly is inundated with requests to be presenting. I definitely am struggling at times, particularly over the last couple of years, when everybody is struggling as a result of the changes that happen during this COVID period. So stigma plays a huge role in terms of the discussion about mental health issues, in terms about the awareness of mental illnesses that are present out there, in terms of the opportunities to seek help as a result of the struggles that individuals are facing, as you've mentioned rightly just now, over the last few years. So stigma is something that we have been trying very, very hard. And you can see Dr. Rostam is in at least 3 platforms trying to do stigma prevention work. Myself also involved with a number of other platforms, because we know that stigma transcends across the whole community of our country, whether it is from the common person on the ground or professionals like all of you over here. There's just such a huge role that stigma plays in terms of reducing opportunities for all of us to get the best in our mental health, and if not, at least to seek help to improve our mental health further as a result of the challenges that we're all facing over the last couple of years.
Okay. Just continuing on this issue, Dr. Rostam, maybe you can share with us a bit what actually drives the stigma surrounding mental health, and what have been done in trying to reduce the stigma, and what we can do moving forward, what can be done to reduce the stigma on mental health.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. Thank you to Associate Prof. Dr. Budi Aslini, my fellow panel, Professor Emeritus Datuk Dr. Wan, and Associate Prof. Ahmad Siddiq, my friend. Thank you for inviting me in this forum, and thank you for giving me a very tough question, what stigma, because it's actually a very complex entity altogether. When we are talking about stigma in health, right, it's the transcend not only in mental health, even in the physical health, because people tend to portray themselves as a strong person, able to withstand whatever problems that they have in their life. And especially when we are talking about psychological and also mental health issues, people try to shy away from having the label of having mental health issues. Even when we talk about mental health issues, people would actually thinking about mental illness, which is wrong altogether. Prof. Amir already discussed at length pertaining to the definition of mental health according to the WHO. And I would say that one of the main issue when we are talking about stigma is because people always associated mental health with gila or mentally ill or mentally unstable or any derogatory words or phrases that we use for mentally ill patient, which is again wrong. So first and foremost, when we are talking about stigma, it started from ourselves. Self-stigma is actually one of the major hurdle for people to, in order for them to seek treatment, because people don't want to associate themselves to any kind of mental health issues again, or mental illness or disorder. People is actually comfortable to say that they are depressed, but they don't want to be labeled as a depressed patient. People can say that they are anxious, but they don't want to be labeled as an anxiety patient. So there's actually a very big difference between an anxious person and an anxiety patient, and people tend to have this kind of idea that all this emotion is just a normal emotion. So that's one of the reasons why people will have the tendency to label people with who come to our clinic or any kind of mental health facilities in Indonesia, and saying and actually labeling them as lemah or weak, or maybe not having a strong faith, or not having a good iman, or whatever the words that they are using to them. Because all these labels actually because people is not able to understand what actually mental health issue is all about. So the stigma comes from that misconception or misrepresentation, or sometimes misidentification of mental health issues or mental illness altogether. And people always associate mental illness as something that cannot be treated, which is very wrong again. It was many years ago, but nowadays with the technologies that we have, medication that we have, psychotherapy modalities that we have, actually mental health issues or mental illness is something that can be treated easily compared with maybe 10 or 20 years ago. So the stigma comes from this kind of labeling and this kind of misconception about mental illness altogether. And then from self-stigma, it comes towards the community stigma towards the mental illness, because the representation of mental illness in media in our community is always I would say the bad faith. People make jokes about people who has mental illness. If you go even let's say we watch any kind of comedy in the TV or any kind of social media, we can see that the representation of mental illness or people with mental illness is always associated with the people that can be joke around, people that can be played around, and can be bullied. And then this is actually something that causes more pain for people, especially suffering through mental illness, to come forward to get the treatment. So the misrepresentation of mental illness in media and how people talk about mental illness actually contributes to this kind of stigma. And on top of that, we have lots of what we call as the derogatory label towards people with mental illness. As we all know, in Malaysia, we can, sometimes people use the word kuku, tiga suku, putus waya, gila, and then mewayan. All those words are actually strong words. And obviously, all these strong words carry with it a very negative labels. And the one who suffer through all these labels actually the ones actually really suffer through the mental illness. And of course, it's actually stop people from getting forward to get a treatment from the specialists or from the professionals. So all this is actually contributes to the stigma. And of course, with the stigma comes the next problem, which is actually prevent people from coming forward to get the treatment.
Thank you, Dr. Rustam. So I would agree with you in terms of the awareness. I think awareness of the community on mental health is or the lack of it actually contributes to the stigma that surrounds mental health. So, in the last 10 years, would you say there has been any improvement in terms of awareness of mental health globally, and particularly in Malaysia? Has there been an improvement in terms of awareness on mental health, in terms of support for towards the community in terms of mental health in the last 10 years, Dr. Rustam, in Malaysia?
You might have frozen there, Doctor.
Yeah, I think Dr. Rustam is a bit is probably having some issues with his line.
I can take that question. So I
Yes.
think, yeah, over the last decade or so, definitely we've seen an increase of awareness. In fact, over the last 5 years, it's been definitely much more. And the pandemic, if there's anything good to say about it, apart from the fact that there's no traffic jams out there, which is horrendous in Kuala Lumpur at the moment, is that definitely it has improved and increased over the last couple of years. In fact, in this country per se, for example, we've had the first two budgets in the last 2 years where they've contributed a number of funds for mental health related activities, which has probably been the first time that the government has actually acknowledged mental health to be a major issue in the country, which will definitely affect the productivity of Malaysians in order to propel us all forward as a result of the last couple of years with the pandemic of COVID-19. So the awareness is increasing dramatically. However, we are really playing catch up to the major issue at hand. The awareness among our general lay person is probably even better than the amount of awareness that we give to professional colleagues like all of yourselves over here. If you look back and reflect on the number of times that you've been shared on a mental health issue, I probably think that you can count it by fingers, actually, if you really think about it. Definitely, the community has been receiving a number of programs on mental health almost weekly, if not monthly, from various NGOs. So definitely, there is that that discrepancy over here that has been happening, and I think Dr. Rostam will be able to probably even share as well in a hospital. How many of our colleagues are still reluctant to refer their patients to us, and these are among professionals at the Budi, and this is among doctors themselves. And we're not even talking about colleagues like yourself from the dental fraternity, from the pharmacy fraternity, from the nursing fraternity, within the medical fraternity, acknowledging the role that mental health has in our health in general. And of course, as a result of that, we are still, as I've shared with you just now, having that discrepancy in terms of the number of people struggling with the mental health issue and number of people coming forward to assist us, to get assistance to improve on that. Dr. Rostam, anything to add since you're back online?
Thank you so much. When we are talking about referral to inpatient referral to us, right? Of course, we are the main issue with this inpatient referral in hospital setting is actually because even in our medical fraternity, the problem is actually people does not really know when and what to refer to us. They don't really understand what's actually the issue with the patient, and they don't really know what we call as the soft sign of a patient who suffer from mental health issues, especially when patient comes with very severe physical illnesses, chronic illnesses, prolonged hospitalization, multiple medication. But that's the reason why I would say that the referral rate is technically low, especially in the hospital in which there is no CL service, means that there is no consultation liaison services in the hospital. Because the presence of CL, I would say, is actually a very strong indicator for higher chances of mental health referral to psychiatric team because the awareness comes with the specialty. And nowadays, for the past 10 years, right, I would say that there is actually an increment in terms of inpatient referral. But I would say it's still not enough because based on the statistic and study that we have, technically there is actually more than 50% of the patient that is supposed to be referred to us is not yet to be referred while they are inpatient. And of course, there is actually an issue of the longevity of the management of the patient in terms of the continuation when the patient is discharged from the hospital. Because the second issue when we are talking about inpatient referral is actually because patient themselves is not really keen to be seen by a psychiatric team, because they say that they come in because of heart problem, they come in with renal problem, why they need to be seen by a psychiatrist. So again, there is a stigma behind this issue, but they don't know that psychiatry or mental health is not about mental illness only. It's actually about the holistic health approach or holistic management of a person that's actually very pertinent in terms of to make sure their physical health is actually at the optimum level. Because we know that it's actually a very strong relationship between mental health and also physical health. Without a good mental health, we will suffer through the physical health and their complication and their comorbidities. So these are the things that I would say that we need more of a platform to educate people and to advocate about getting early help from mental health professionals. I've seen in Singapore, for example, when I was practicing there as part of the fellowship program, they are more open in terms of getting us as part of their management. Even though they come for renal problem or medical problems or any kind of chronic health issues, they are more welcome to us as part of their management team. So I would like to see this kind of culture comes into Malaysia, because with this kind of holistic approach, I would say that our general health will improve by leaps and bounds.
I just want to add, Dr. Budi. If they had any consultation licensed psychiatrist, they would probably be reluctant to see. But if Dr. Rostam comes into the picture, it'd be very much different.
Yes, I think I will agree with you with that. Okay, now actually I would like to sort of zoom in a bit on dental in terms of mental health and dental wealth. So actually we have with us Prof. Datuk Dr. Wan, who has been working in various sectors, in the government sector, in the academia for dentistry. And I think you carry with you a wealth of experience. So Datuk, could you share with us in your capacity as the past director of our health and also as a dean, some of the challenges that you see that are being faced by the people working with you in dentistry in terms of mental health? What are some of the main challenges or factors in dentistry that contributes as a risk factor for mental health? Could you share with us?
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan selamat sejahtera. Thank you very much for inviting me to be in this panel on Smile 2.0. Actually, I'm privileged to work with staff or competent personnel and with good attitudes and good work ethics, but all is not perfect. There are a few who pose some problems. One of the common problems that we face is those who come to work always late. I think the government has already recognized, but they do work very well. They work very well, but they come late, and the government recognizes and have introduced that flexible time. I think that helps a lot of those people, because we see that they can work very late because maybe some of the problems they face at home, but there are also who comes early, but did not perform very well. They come early, but they do not start work early. We also have problems with people who cannot get along with people, cannot work with teams. Where I come across staff who cannot work with people, but working alone, they do it very well. And there are also staff who cannot, when there's change, difficult to accept those change. I don't know why, but we need to talk. We talked with them when we were there. We talked to them, and in dentistry itself, we are working in this environment in oral cavity, in this orifice, small orifice, and in that orifice, there's so many things, structures there, teeth, the tongue, the mucosa, and so many things there. And when we are working, doing a procedure, the there's a lot of saliva splashing around, and the burrs running around at 400,000 rounds per minute. So you have to take care very well so that it does not hurt, does not result in any those injuries to the patients. And you can see that this I think one of the reasons that we come across that patients, that dentists have this stress. And dentists also are, when they work, they are dependent on equipment. Once the equipment is down, they are very in the stressful position. They cannot do the work. They cannot do that clinical procedure. They can talk with patients and so on the others, but clinically they cannot have to solve the clinical problems with that. And they're all with as all in health personnel. There are also what we call this. They are also with challenges with these infectious diseases, and these also add to the stress. And with the recent COVID, they have to don those PPEs, and so similar with other health personnel, and they are very stressful. These are some of those things that we see in dentistry. And however, you can see that they keep those problems to themselves. They don't talk to others. They don't want to share with others. They don't want to do, as you have mentioned, rightly mentioned, the panel mentioned, there is that they keep to themselves. And they see that as a stigma. You talk a lot about this stigma just now. And they see that those problems are the things that need to be solved by themselves, not by others. They don't link that with mental health. Mental health that we have said is taboo. Is something, is a stigma. They don't see that integration of, as you mentioned, integration of physical, mental, and social well-being. And so these are some of the things that you see that mental health and physical health and social health are to them are separate entities. So this is from what I see, and also for the students. For students, they are stressful because of those the schedules that they have to face, and these schedules are also related to patients in which they cannot control the patient. The patient do not come for the appointment and so on. And some of my students, they try to resort those to spiritual means, through prayers, to recitals of recite certain verses of the Quran to help them to overcome it. But they seldom come. They don't talk with others. Or maybe with their friends, but with the staff, they may seldom talk. So when I was a dean at one time, I appointed one of the staff, a motherly figure. So if the students have some problems, they can go to that person to talk about their problems. So these are some of the things that we face in dentistry.
Thanks. Thank you, Dato. Actually, I would agree with you. I mean, in terms of dentistry, there are different types of stresses that may impact on the dental professional, interpersonal stresses, and then stresses in terms of the operating procedure, I think the nature of working as part of the dental team is that you are very reliant on one another, and then having to work in a team can be a source of stressor if the team dynamics is not very good. So I think that's one thing that um, is very clear in terms of dentistry, because it's always a teamwork, and so if the team dynamics doesn't really work, it can impact on an individual in terms of the amount of stress that they're having. And I think Datuk Wan mentioned about the sound of the burr. I mean, for those who are familiar, I mean, most of the audience in here are probably with the dental background, but I'm sure Dr. Rostam and Prof. Ami has been to a dentist. So actually, I'm talking through experience. Being in a dental clinic and listening to the ultrasonic scaler going on, even though it's ultrasonic, and that screeching sound throughout the day actually contributes to a level of noise pollution, which actually can be agitating and does increase your in terms of it can become a source of stressor actually. And we are dealing with the oral environment, which is not the best environment. Is it can be very dirty, it's wet, and so it's different from, let's say, if you're a tour operator and you're looking at the sunset and the beaches. So the nature of dental work itself can be a form of stressor. And but of course, I think there are some possibly anecdotal evidence saying that dentistry is one of the highest, most stressful jobs in the industry. I don't know how far this is true. I mean, there are some papers I know that contradicts this and says it's only anecdotal, or maybe it's being written by dentists who think that we're overly stressed. And I don't know what to say about that, because I think everyone could say that their occupation is more stressful. But even though I mentioned that being a dentist, we work as a team, but being a dentist also means that sometimes we work in isolation, because when you work in your own clinic and you're cut off from the outside world and you're only seeing your patients, that may also impact on our mental capacity. I mean, on how we, because your outlook can be quite narrow because you're focusing on such a minute thing. And now with the competition that we have in our industry, it's really causing the concept of perfection dentistry. So, you're looking at a tooth and you're trying to make it look as authentic or as natural as the real thing. And you're judging yourself on whether or not, your class 2 composite restoration is looking normal. I mean, looking like the original thing. Whereas in comparison, the patient probably can't even see the tooth, but your own desire for perfection dentistry can actually impact on the dentists themselves. So those are some things I think impact on the dental profession themselves. So Datuk Wan, while you were in Ministry of Health or even in USIM, was there any support system in place to cater to the personnel if they were having any issues? Let's say if they were problematic at work, or if they were having mental problems, was there any support system in place to help these people?
Okay. In those days, there was no counselors in the in the department and so on. So those with problems, you try to talk with them. But the problem is, we talk with them is when we do not know how to talk with them. We do not know how to respond to them. We don't know what questions to ask them. That is a problem, and it may. Sometimes when we refer to others with these problems, they look at that not as those who are trying to help them see that not as problems related to mental health, but problems related to their work. Something incompetence or whatever things. For example, they have the deadlines, but they don't realize that some of these problems is because of those deadlines. always they say always that in management, always that they give it and you want to do it immediately or the next day and so on. Not much time, and there sometimes instructions were not clear, and sometimes tasks given were not related to their capabilities. So the problem is that there was no specific what you call structure within the organization to help those people in those mental health problems, because I think at those times, those days, they don't not mental health was not brought up in the open. It's only after this pandemic that you can see people willing to talk about this mental health. So we need to look into that. Those establish those structures, health structures within the Ministry of Health also, or maybe now they have, I don't know, but my time they don't have that. And also in institutions they have, these counselors, they can be referred to them, to refer to doctors, psychiatrists, and so on. They have certain aspect, but sometimes before they go there, then they themselves, the students themselves, the people themselves, the staff themselves have to talk. They have to look into somebody for students, some mother figure to talk with, or some for staff, somebody in which they can talk with. Sometimes it's not. They are being talked to most of the time. They need to talk with the others. So that's what my perception is. In the past, there were no structures, but now it's getting what you call much better with that support system getting established.
All right. Thank you, Dato. It's interesting how you mentioned that now more people are talking about mental health due to the pandemic, and I think the pandemic has also caused more mental health issues to come into light. Maybe Dr. Rostam, could you probably share with us in terms of the pandemic, has there been any changes in the trend of mental health issues that has come about? And in terms of the cases that you've seen pre and post pandemic, are there any changes in types of cases or numbers that maybe you can share with us?
Okay, thank you. So first and foremost, when we are talking about pandemic, right, one of the much discussed topics during the pandemic and even after the pandemic is actually about the pandemic fatigue, in which people is actually suffering through the 2 years of restriction because of the pandemic that happens all over the world. And the pandemic fatigue comes with it symptoms of mental health issues, such as anxiety symptoms, such as depressive symptoms, burnout, stress, and issues with substance use, and issues with interpersonal problems, and many other things, including work-related. So pre and post-pandemic, I would say that one of the major changes is actually mainly number one, people is more aware about the importance of taking care of themselves during the pandemic, and now after it. And when they are talking about taking care of themselves, one of the most important thing is actually about mental health, because the other things that we have is actually not very easy to control. For example, the economy, the financial issues, the work issues, the pandemic issue itself, the spread of the illness, everything is actually very difficult to control. But in terms of mental health, that is something that we as a person can do something about it. So that's one of the reasons why in terms of awareness pertaining to mental health, I would say that there is actually an increase of people who's actually coming forward to get treatment or to seek treatment. And number two is actually people is actually already expecting, actually the World Health Organization already expecting that one of the post-pandemic major issues in the world will be mental health issues, because people are struggling to be back to normal again. And I would say that most of us cannot remember anymore what is actually normal and whether now is normal or not. So most people is actually still struggling with this normalcy. People is still not really confident about whether we are now okay or not okay. So that is actually something that already predicted by WHO, and we can see it happen now. But at the same time, one of the issue that we are seeing right now is actually there are more people who actually self-diagnosing themselves to have mental illness, which is very dangerous, I would say, because it can cause stigma towards people who are actually suffering with mental illness. There are people who comes to us with mental illness diagnosis, which is not true at all, just based on their Google and the information that they get from social media. And this can actually, as I said, can mislabel or misrepresent people who actually suffer the mental illness themselves. So there are goods and bad things that happens post-pandemic right now. The good things, as I said, the awareness actually increased. People is actually more open to talk about mental health issues. People is more aware, and people would is actually more eager to know about mental health issues altogether, because they want to know about themselves. And I would say that when we are talking about mental health, mental well-being, and also our health in general, the awareness and the eagerness to learn about ourselves is actually very important for us to make sure that we are always aware whether we are okay or not. But the bad thing, as I said, one of the bad thing that we saw is actually we are seeing right now is actually self-diagnosing people, which I would say that for all of you out there, one of the most important thing about mental health issues or mental illness is actually do not label anything towards yourself first. Please come forward to the professional before you put any kind of label to yourself, because it can be dangerous. As I said earlier in the first round of question, it can cause self-stigma. Self-stigma can cause negative consequence to yourself.
I think Dr. Rustam is frozen again. Okay. Dr. Rustam? I think Dr. Rustam is having connection issues again. Okay, but while we okay, Dr. Rustam, are you back? Yes, you are back.
I finished already.
Okay.
Yeah.
Okay. Okay. I think we lost you for a bit at the end there just now. Okay. Okay. Maybe maybe I'll just continue, because I think you probably don't want to repeat yourself. Okay. Prof. Amir, I'm going to ask you something which I think is a bit, I don't know whether it's a bit out of topic, but you know, we both are very familiar with tobacco control. So I'm going to use tobacco control as an example of the question I would like to ask. When it comes to tobacco control, I mean, when we do smoking cessation, for example, that is considered as a downstream approach when we actually stop people from smoking, right? And the upstream approach would be through legislation and preventing people from smoking altogether. So in terms of that, but in terms of mental health, and let's say providing support, would that be considered as a downstream approach also? And in terms of an upstream approach, because I think Dr. Rosta mentioned just now how in terms of the pandemic that there are many things that we cannot control in terms of financial hardship and being isolated. Those are things that we can't really control, but what we can control is how we maintain our mental health.
Yeah.
But when we talk about mental health, is there an upstream approach that can be done to actually protect our mental health?
Yep, definitely. I think first of all, I just wanted to put a shout out to Datuk Wan bila cerita pasal berhol tu, saya sendiri ada sedikit kegelisahan tadi ya. Bukannya doktor, dentist nak gelisah, yang kita mendengar tu pun teringat tiba-tiba bunyi tu, macam ada hallucination pula tadi. Sampai siap duduk jantung. Lepas tu Budi pergi reintroduce balik experience tu. Saya dua kali kena experience tu dalam satu sesi. I cannot imagine. I terfikir semasa ni lah kawan saya Dr. Rostam, Dr. Ib Shah dekat eye care clinic tu, macam mana lah hidup dia hari-hari kena dengar Budi macam it just crossed my mind. I think we should reach out to him, Rostam, and ask him whether he's okay or not. Yeah. So I think going back to your question, Budi, it's a really nice question, and I think it's a really interesting question because similarly, like our experience with tobacco control, there's going to be two groups of individuals or two groups of people that will be related to the same topic. So similarly, as we've discussed in tobacco control, we've got the public health group doing the upstream, and then we've got the clinicians doing the downstream. That's the same also for mental health related issues. However, I dare to say that for mental health, it's even more so because there's this thing called the social determinants of health. And it's really something that Dr. Rostam had highlighted that we cannot change, but we sort of can, but it's really, really difficult. For example, we know that poverty is a major risk factor for mental health issues.
Yes.
Now, poverty really requires whole government literally to do its part. Yeah, it's about not only employment, but it's about training. It's about providing opportunities and resources for segments of populations to actually get out of this particular situation that they're in. Because we know that people who live in poverty in the lower socioeconomic subgroups will definitely have an increased risk of developing many health problems, including mental health. Now, I think even the policymakers in the Ministry of Health and other ministries will be actually struggling to amend policies just to deal with poverty, because it's really something that everyone should play its part in trying to do. So there is that little bit of trickiness in terms of mental health. However, in saying that, there definitely is going to be a lot more opportunities for us in mental health to improve the situation on the in Malaysia. For example, we still have archaic laws that are non-progressive in terms of allowing people to come forward. If you're not familiar, there's something called the 309 section in the penal code, which penalizes individuals who might, at the highest point of desperations, attempt on their life, but instead of getting help, they get actually punished to be put in jail as a result of this particular act, which definitely needs to be amended at some point. So definitely there's an opportunity for us to do something there. As I shared with you just now, over the last couple of years, we've been lucky to have some direct funding for mental health. This was never the case. We talked about at the very beginning that health has three components. You invest a lot in physical health. Many ministries do that. However, you neglect in totality mental health until bila batang hidung kena sendiri dalam situasi COVID, then probably now only you sort of realize that, oh, it's really, really important. I think we need to do something about it. Yeah. So definitely there is, there is definitely an opportunity there to improve policy to get direct funding. In fact, some countries like I think Australia and the UK, they even have ministries on mental health or happiness, which looks at this particular issue, because they know, as Dr. Rosam had rightly mentioned, that over the last 2 years, it's something called the hidden pandemic. As we were all dealing with COVID-19, the physical illness of this infection, on the parallel, there was this problem with mental health, which was just brewing. And now as we move towards endemicity and people are forgetting about the COVID-19, the mental health issue is now coming to fore. So we're seeing a lot more people coming forward seeking help when the number of individuals to cater to this number is actually very, very little. So a policy definitely needs to be put in place in order, number one, to ensure that the rakyat receives the best level of care. Therefore, a definition of the mental health care providers needs to be done, and that's done on policy level. We know there are doctors called psychiatrists. We know there are clinical psychologists out there who are not regulated in any form or fashion in the country apart from self-regulation. And we know that there's counselors. Now, what about those who are working in human resource that do some level of support? And what about those who are supporting each other, like peer groups, for example? They do some mental health work. They probably do need the recognition. However, there's no yet policy to ensure that these people are providing the best level of care for everyone out there who might be dealing with mental health issues. So this is just to give you a little bit of example on what's out there. What about things, for example, in terms of media reporting? We see a number of words that Dr. Rosam had mentioned at the very beginning of our session, gila contohnya. Yeah, words that shouldn't be on the front page, highlighted in bold with a font that everybody can see. So these kind of destigmatizing efforts needs policy. If you're wanting to get the relevant authorities to do so, i.e., the journalists, some of them still proceed towards doing the sensationalizing of negative connotations of mental health issues, which will then increase stigma in society. And I think more recently we're seeing a number of quacks, real quacks, coming forward, stating that they are mental health care providers without any substance. And I think this is why Dr. Rostam had, stressed, I think at least 3 times in his short session, that please don't self-diagnose. Please come forward if you're really, really feeling that you need that support. Because for all you know, you're just experiencing an extreme form of normal emotions, and that's normal. Yeah. If you're feeling pretty stressed out when you're quarantined because you get COVID-19 in a single room without anybody around, and that's Ubuntu, looking at the four walls. It doesn't mean that you're mentally ill. Yeah, it just means that you're probably bored to death or really struggling with a higher emotion of stress because you are isolated in that room, for example. So these are, but there are people that will come forward on social media. In fact, Shopee pun ada, who claim that they are mental health providers providing support through Shopee. Bisa ada discount lagi, buy 3 get 1 free. I don't know how it works, and people actually fall for it. That's how desperate and needy people are at this point of time for mental health support. Because kalau nak jumpa Dr. Amir, Dr. Rustam, mungkin waiting list sebulan. So I think these are some of the challenges that face that we need some level of policymakers to do a difference. So that's the part on the top bit, right? Where colleagues like for ourselves is Dr. Norashi Kim, Ibrahim is doing an amazing amount of work with colleagues like Dr. Norli and Dr. Raihana looking into the legislation part. Now it's really our role on the bottom, as you rightly mentioned, to provide that support. And I think we're also not doing the best that we can. There are still lots of limitations, as I shared just now, highlighting how busy some of us are. To get an appointment with us in the public service could be quite challenging. For some of you here who I know are seeing some of us in public and private, you probably will have experienced that kind of situation. So again, we can do more. We can definitely do better. But we are also limited by policies that govern the number of products that come out, i.e. doctors or counselors or psychologists. So again, there is this yin and yang situation or supply and demand issue, which happens, which, as I've shared, our investment has been poor for many years, and therefore we are now reaping the rewards of poor investment in 2022, moving towards 2023. Yeah, and I dare predict that the issue with mental health is only going to get bigger. And I've shared with relevant authorities that there needs to be targeted, continuous funding for all of us doing mental health care work, and quicker decisions, because this thing's only going to increase. I'll give you one example of the problem. Yeah, the Penang Bridge. This month alone, if you looked at the statistics, I think there were about at least 8 individuals, or the last 2 months, June and May. I think 8 that were reported to have actually jumped. Ini yang kita nampak dan kita dapat tangkap, belum lagi yang kita tak tahu. Ya, that's a lot, I think. And what are we doing about it? How quick are we responding to this issue? There are many bridges actually in this country. So these are the kind of things that are on the policy side. Now, when the person comes forward, how fast does he get to see somebody? As I shared with you, you can make a study now for all of you out there. You just make a call to your nearest hospital, whether it's public or private, and just say that you want to get an appointment with a colleague because someone in your family or yourself is struggling with a mental health issue. See whether you can get one this afternoon. I definitely know I'm going to be full this afternoon, so I can't see you. I don't know whether Dr. Rustam has even clinic this afternoon that he can see. So if you cannot get somebody this afternoon, you know already that it's going to be difficult. Now, you ask your same family member, try to get an appointment to see one of your friends in dentistry and see whether you can get an appointment. I think I can get an appointment this afternoon. So that's just to say that there is that challenge in access, that we need to do something more from the top and also the bottom.
Okay. All right. Yes. Yeah. I can see that the challenge in terms of mental health, in terms of dealing with mental health across the spectrum, in terms of upstream and downstream, it is quite challenging at all levels actually. But
In
it's
fact,
something
Dr.
that
Budi, I just wanted to add. Now we are mainly talking. When I was sharing with all of you just now, I was mainly thinking about the adults.
true.
Now, if you go to a subpopulation like children, oh, that challenge is even more. I I dare not even say how easy is it for your child to actually get access to any of us, actually, myself included, because the number of subspecialists in that field is even lesser than many other subspecialists within our own fraternity. So that's a kind of issue that requires urgent attention, I think, in terms of policy, both on the public health level and also, of course, in the service level in this country.
Yeah. Yes, I think yeah, we barely, I mean, we have not even touched about the issue of mental health in children, just in adults, and I think there's a wealth of problems there. Okay, so actually we are a bit running out of time, and I have a dozen of questions from the and apparently I'm getting messages that there are more questions which I'm getting, but I'm going to be a bit how do I say, selfish. I do have one question from myself first that I would like to ask before I unload on all these questions from the audience. Actually, I would like to ask now, in this era of social media and influencers and likes and all that, maybe this question is best for Dr. Rostam.
Yes, I think Dr. Rostam is the best individual. I was
Yeah.
waiting for you to say his name.
Yeah, because I'm gonna go for Dr. Rostam, because after this I'm gonna have to bombard Prof. Wan with all the questions from the audience. So I'm gonna give Prof. Wan like a minute to get prepared. But Dr. Rostam, before that, can you tell me, do you think, in your opinion and in your experience, has this culture of social media and influencers and all that contributed to more mental issues in the community?
I would say that essentially the culture that we see in social media, especially with the influencers, right? It actually increased the awareness about the possibility of people suffering through mental health issues. Whether the issue that they highlighted is actually something which is true or not, is actually totally different thing altogether. But the positive things about all of these things, actually it creates awareness, and from awareness it will actually push people to find knowledge, which is actually the knowledge is one of the things that we need to tackle. That's the reason why nowadays we have lots of professional health professional that's actually into social media, because we want to be the advocates in terms of the proper knowledge, appropriate knowledge, and the factual things about mental health issues or mental illness and everything about mental health altogether. And with awareness and knowledge, of course we are talking right now, when we see through all the social media, they are talking about self-empowerment. And Prof. Amir already highlighted about all those facts that talking about mental health, mental illness and how to treat mental illness. I would say that this is a fight that we need to take head on, in terms of we as the professional need to be more upfront in terms of dealing with all this issue in social media, because I would say that this is the best platform nowadays. Everyone is actually on social media, and everyone want to seek something in social media, whether it's actually an information. Most of the information that we have in social media, regardless of about any kind of any kind of health issues, I would say that most of it is actually not really to the fact or not really true. There's lots of things actually mixed between the fact and the lie and everything like that. So these are the things that I would say one of the things that we need to be focused on, because the awareness already there, and actually the knowledge is there, but for us to really brush it up and improve the way that we present it in the social media platform, for people to be attracted the information that we are giving to them. And then the number 3 is actually when we are talking about social media, we are also talking about expectation. As Prof. Amir already highlighted that it's not easy to get to seek treatment nowadays. It's actually not easy to get the appointment as soon as you want. And the expectation is something that can really push the policymaker to do more in terms of providing the service, touch shifting from the government to private or from private to government. All those things actually very important in terms of policy making for a few years. And the fourth one is actually by highlighting more issues in social media, it's actually will help in terms of improving the perception towards mental health issues. So, but again, this is, I would say that it's actually a war about perception again, because there will be people who highlight it in a negative way, it's actually putting things in a negative way, but there will be people that's actually putting it in a good way, supporting people with mental health issues. And we have seen a lot of NGOs that comes forward in social media to help in terms of giving support to their peers that suffer through mental illness. The good things that happens nowadays.
All right, thank you very much for that explanation. Okay, so now I'm gonna finally open the floor to some questions from the audience. We have about 20 minutes left. Actually, we have a lot of questions, which I'm sure I will not be able to go through all of it, but I'll try. So for the first one is actually to Prof. Dato' Dr. Wan. Okay, to Prof. Wan, you have been a great leader all this while. How do you manage to control your staff by being strict and at the same time understanding?
Yes. Okay, thank you very much for that question. It's very difficult questions. You recognize that I was very strict. I follow rules. I will follow procedures. Because I am from the old school. We have to follow procedures. You don't come, work late. You come no late, then we have to tell you. But the thing is that we need to be considerate also. Although I may be strict, but in my heart, I'm also have a feeling for the person. Have to make sure that we are dealing with people, and we have to make sure that to me, although I'm direct to them, but at the same time, I give reasons. Usually, in this case, I may be strict, but I give reasons to them and for them to ponder. So this is my approach. The old school approach. Maybe now is a different way of approach in which I'm trying to adjust myself. Okay. Yeah, I think that's my response to that question.
Okay. All right. Actually, the next question I think I'm going to address to Dato' Wan juga. How can we educate dentists the way they treat patients is actually making a difference and actually can impact on someone's life?
One is that we are always talking about patient-centered care. The behavioral science aspect is very important in dentistry, in which it must be incorporated in the curriculum. And one of the aspects in this is this patient-centered, in this behavioral science is patient-centered care. We have to make sure that we see patients as a person with feelings, not something that we work on this laboratory. So these are things that we have to make sure that we also at the same time we have to consider the ethical aspects of care. All this doing good, beneficence, non-maleficence, this autonomy of patients, which previously these are something quite different from previous ones. We need to make sure that we talk with patients. Make sure that we give all the information to them, and we get the patient for the informed consent. So these are some of the ways in which we need to ensure that in our care, patient-centered care are important, and behavioral science is also important discourse within this all curriculum in the curriculum of BDS.
Yeah, I agree. I think now there's more emphasis on behavioral science and professionalism in our curriculum to educate the dentists in terms of that. Okay, so the next question, which is very interesting, I'm just going to throw it out there. So feel free to answer, Dr. Rostam or Prof. Amir or Datuk Wan. Currently, there's an effort by some countries like Japan and Britain to push the current working days from 5 days to 4 days a week to reduce burnout among workers. Is there a plan similarly like that in Malaysia? Or do you think that there will be a plan to do that?
Well, I think in my understanding, there are definitely lots of efforts looking at many aspects on how to improve working culture. However, when we talk about burnt out, often we're talking about individuals who are super committed there are a number of individuals that are dealing with burnt out that have actually a lot of mismatch in terms of their roles in the employment service. And one of the research that really shows in terms of how to improve on burnt out and happiness in general is actually engagement at work. So I think this is where we've seen over and over again, for example, in the medical fraternity, those who are burnt out sometimes have trouble in terms of participating in the work that they were given. Yeah, they could be wanting to do medicine but not in a certain field, and we know that sometimes they don't have that choice, particularly during COVID when they were asked to work 24/7, most of us here as well included, that increases that risk of burnt out. And of course, in other fields, that similar issue has happened as well. So burnt out itself is not just because of the working amount of days, actually. There are various aspects of it, but definitely there's a lot of efforts in order trying to see how we can further improve on working culture and happiness at work in looking at various methods like, better remuneration, better working environment, more activities, and including reduced time at work.
All right. Okay. Okay. I hope that answers the question. Okay. The next question that I have from the audience is that how can we recognize people who are hiding the fact that they have mental health problems? People don't always hide mental health problems because they're afraid of the stigma that comes with them. Sometimes it's because they don't know that they have one. So maybe Dr. Rustam would like to answer this.
I would say that there are two things, very important things whether we want to know if we want to know whether we are okay or not, or whether we want to know our friend is okay or not. So number one is actually the functional level of the person. So if let's say we notice that there is a drop of functionality or drop of performance of a person, of ourselves, means that something is not right about ourselves. That's number one. Number two is actually about the personality changes. So if there are any kind of personality changes in terms of how they react to us, how they interact with us, how we socialize, everything, something is not right about ourselves. So functionality and also personality changes is actually two major things that can be, I would say, the red flags in terms of mental health issues. Of course, when we are talking about symptoms, right, there are hundreds of symptoms that can be moving towards diagnosing someone with mental illness. But if we notice these two changes, means that we need help. Not to say that we have an illness, but obviously we have problems that we need to you need to tackle together with other people. Maybe with a professional, maybe with your friend, or maybe with your bosses or your colleagues.
Okay. All right. Yep. Thank you. So actually, the next question is actually about there's a question about identifying mental illness also. So a participant has asked, how frequent do we need to take the DASS test, DASS test, to identify the mental health status?
Kata Rostam ni.
Yeah, I mean.
I think we don't need to do it regularly. Because that is not it's actually not a tool for us to diagnose any kind of mental illness. It's just a tool for us to screen through whether we are okay or not okay. I wouldn't advocate for the use of a personal capacity, because it doesn't help in terms of really looking about your own health issues. My best tip will be telling you that if that you feel not comfortable with yourself, you are not feeling comfortable with how you work or how you perform, how you socialize. These are actually more pertinent or more important points for you to seek help rather than use any specific tools. I would say that just leave the tools to the professional, because the interpretation of the tools is very important. And of course, when we are using it without a proper knowledge about the tools, it can be misleading. I've seen a lot of people who use DAS and comes forward with a diagnosis of severe depression, severe anxiety, and severe stress, but it's actually not the case, because again, DAS is just for screening. If you want to do it, yes, you can do it, but bring the result to professional to see it together and determine whether you have an issue or not.
Okay. All right. Yeah, I think that actually, you've also answered another question through your answer, because someone also asked, how soon should a person seek for help once they have taken the DAS test and they got the results that they have high anxiety? So basically, if they are concerned and they've gotten that result, then they can go for further investigation, right, with a professional. Okay, so the next question is possibly I would like to direct it to Prof. Wan first, and then we'll see where it goes from there. An audience actually asked, can I have a comment from the panel about the issue that most of the dentists are perfectionists, and self-satisfaction is something that can be the cause of stress among dentists and lead to OCD. So maybe
Okay.
Prof. Wan would like to comment on that first.
All right, I see that. Perfectionists, of course, we have to look at standards. We have to make sure that we conform to standards. When you do things, we have certain procedures. We have to follow those procedures. We have to ensure that the product conform to those criteria. So that maybe can be construed as perfectionist. Okay, the others maybe.
Okay. Do you think maybe Prof. Amir or Dr. Rustam would like to add? Do you think that this can actually contribute to what this audience has asked, whether it can contribute to OCD?
I think I tunggu Dr. Rustam ni.
Okay, let me do it. Okay, first and foremost, when we are talking about perfectionism, right, it's not a mental illness. It's actually a trait, a personality trait or a temperament of a person. So we can have someone that has a perfectionistic traits, which is very important in our job, daily job, because we need this trait to really perform. We need this trait to improve ourselves. We need this trait to be able to give the best to our client. So I would say that perfectionistic trait is very important to all of us. The problem will be about OCPD, which is a stand for obsessive compulsive personality disorder, or OCD, obsessive compulsive disorder. So perfectionism doesn't cause you to develop OCPD or OCD, because as I said, perfectionism is just a trait. When we are talking about OCPD or OCD, both of it is actually fall under the roof or under the umbrella of mental illness. OCD is the severe form of obsessive compulsive behavior that need to be treated, and most of people with OCD, they are not able to function. If you are a dentist or you are part of the dental team, you are not able to function to the level that you need to perform. So technically, you are become a dysfunctional in terms of social, in terms of personal, in terms of your occupational. So dysfunctionality on all the components that you need in your life. So that is OCD, and you need to be treated. And then, as I said, you will not be able to function. But OCPD, there are many of us has these traits, not necessarily a disorder, but we have OCP traits, which means that we can be more than just a perfectionist. For example, if let's say you have a tools on your table, so there will be people who like to just arrange their tools based on the size, based on the length or whatever it is. They don't want it to be touched by anyone else. They just want to do it on their own way, with the same distance every day, with the same tool every day, and these are what we call maybe they have OCP traits, but usually it does not cause any problem to hit themselves because they like what they are doing. Unlike OCD, the people who suffer through OCD, they dislike what they are experiencing. But the OCP people, they like what they are doing. But people will be distressed with them. People will be stressed up with their behavior because sometimes their behavior can cause problem to other people. For example, as I said, when they for him there is a way for arranging tools, but for the others, no, we can just arrange whatever we like. But these people will be very particular, very rigid in terms of doing this thing, so it can cause problem to others, can cause distress to others, but not to themselves. So OCPD, yes, there are people with OCPD traits, very difficult topics actually, and OCD illness need to be treated. OCPD need to be intervened if, let's say, it cause problem in terms of their social cohesion, social life. But the perfectionism, most of us need it because we are in the field in which we need to be as good as we can, the best that we can. So I would say that perfectionism is okay as long as it does not cause any problem to your life. If let's say your perfectionism causing problems to your life, then obviously it's no more of perfectionism. It's actually an obsession.
I think it's the same concept with stress. That stress can be good thing, isn't it? It actually propels us.
We need stress to perform.
Until it becomes a burden. So as long as it's within control, I think that's fine. Okay, so actually I only have time for one last question. So I'm not going to name names, so feel free to answer if you think that you want to answer. One of my patients attending my clinic has been diagnosed with mental disorder and is under treatment. However, the caretaker claimed that they are not compliant with the medication. As a dentist, how can we advise the patient? It sounds like an OSCE question here, like a scenario in an exam. Okay, so basically the question is asked.
It sounds like a consultation liaison question.
Pandai, Prof ni memang pandai. Okay, I would say that this is not to say simple. It's actually about communication. When we know that our patient is actually having problem with any kind of adherence to any kind of medication, right? For a dentist who is actually attending the client, the most important interaction that you need to build with the patient is actually to know the reason behind why they are not taking the medication. So when you know the reason behind why they are not taking the medication, but they are still attending to the follow-up of the psychiatric clinic, I would say you can give just what we call as the surat maklum malas to your colleague in psychiatry, telling what are the issues that you already managed to get from the patient. Because sometimes our patient has a good therapeutic alliance with their dentist, but not as good with their psychiatrist. So maybe our dentist can help in terms of advocates about the issues that the patient does not dare to tell the psychiatrist. So you all can help us in terms of identifying what are the issues when they are taking the medication. Maybe because of the side effects, maybe because there are lots of confusing dosing, maybe because of the timing of the medication, maybe because they are having other problems that the psychiatrist doesn't know and you know. So I would say that will be the things that I would like you all to help if, let's say, you see this kind of patient.
Yeah, I just wanted to add, I think first of all, it's very progressive that our colleague has actually even considered to refer, and also it's really empathetic that that person has actually even thought about our patient and the struggles that they might be going with because they were not on their medication and wanted to help. And I fully agree with what Dr. Rosam had mentioned. I just wanted to also highlight that there's opportunities for colleagues in dentistry to help us. Often issues with halitosis, dry mouth, receding gums, poor oral hygiene sometimes could be markers that individuals might be on our treatments because our anticholinergic treatment actually dries the mouth a little bit, and our histaminergic type of treatments also do the same thing. So it could also be the first sign that individuals might be struggling with a mental health issue because certain drug use, for example, methamphetamines, also cause oral decay. And this is where colleagues in dentistry can not only identify but also play their part, as we discussed just now, in terms of referring cases to us, so that we'll hopefully be able to assist you as well in improving the patient's life. I like this question. It's actually really, really progressive in the way that it was asked, and kudos to whoever asked that question.
Yes. All right. Actually, I've gotten the cue that time is up, and I really apologize to the audience that we don't have enough time to answer all the questions that are being asked, which is still actually coming in at this point. What I can
Berapa
say is
ratus lagi, Budi? Berapa ratus lagi,
there's
Dr.
at
Budi?
least about 6 or 7 that I'm not able to address, but I would like to say that you can actually contact Dr. Rostam on his social media, and yes, I'm sure he'll be able to address that. And actually, you can also ask further questions on our other webinars, which will be done throughout this week. So we will have other panels too, which may be able to address some of the issues. So unfortunately, we have come to the end of the webinar this morning. I would like to say thank you very much to all 3 of our esteemed panels. I have thoroughly enjoyed this morning's session. Thank you so much for all the brilliant answers and insights that we've gotten regarding mental health. It's certainly been enlightening for all of us, I think. So thank you again, Prof. Amir, Prof. Wan, and Dr. Rostam. It has been a pleasure to have you with us this morning. And I hope the webinar this morning will spark a greater awareness on the importance of mental health and mental care amongst the audience and amongst the dental fraternity. And I hope that we can play our part in improving mental health in our community. So we have come to the conclusion of the webinar. Please stay online for everyone else. We have our opening ceremony coming up after this, and I will now pass the session back to our MC. Thank you very much and have a nice day.
Okay. Terima kasih yang berusaha Profesor Madya, Dr. Budi Asli dan barisan panelis yang hebat sebentar tadi. Sudah tentunya banyak informasi baharu yang kita dapati dalam perkongsian forum itu tadi. Masyarakat perlu ditingkatkan literasi kesihatan mental dan diberi kesedaran mengenai keparahan masalah ini. Oleh itu, amat penting masalah dalam kesihatan mental tidak dipandang sepi. Hadirin yang dihormati, Majlis Perasmian Program Smile 2.0 akan berlangsung sebentar sahaja lagi. Diharapkan para tetamu akan teruskan bersama kami sehingga ke penghujung rancangan. Sedikit pengumuman, yang pertama, segmen tambahan yang istimewa iaitu Sembang Santai bersama Auxiliary Pergigian Everyone Matters akan diadakan pada esok hari jam 3 petang. Yang kedua, ingin saya maklumkan bahawa pautan Google Form kehadiran anda pada hari ini akan dikongsikan di ruangan chat YouTube live pada akhir sesi nanti. Mohon hadirin sekalian mengisi borang pengesahan kehadiran bersama borang penilaian program untuk mendapatkan e-cert. E-cert akan di-emailkan dalam tempoh 5 ke 10 hari bekerja. Sementara menunggu majlis yang akan bermula, sebentar lagi kami hidangkan klip-klip video yang telah kami sediakan. Hadirin yang dihormati, kini tibalah masa yang ditunggu-tunggu, Majlis Perasmian dan ucap tama yang akan disampaikan oleh Yang Berbahagia Datuk Dr. Haji Nur Azmi bin Ghazali, Timbalan Menteri Kesihatan 1, Kementerian Kesihatan Malaysia sebentar sahaja lagi. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan salam sejahtera. Sayang kumbang mencari makan, terbang seiring di tepi kali. Selamat datang kami ucapkan, moga diiring restu ilahi. Yang Berbahagia Datuk Dr. Haji Nur Azmi Ghazali, Timbalan Menteri Kesihatan 1, Kementerian Kesihatan Malaysia. Yang Berbahagia Profesor Madya Dr. Aida Nur Ashikan Abdul Rahman, Dekan Fakulti Pergigian UiTM. Yang Berusaha Dr. Nur Faizah Mak Buhari, Ketua Jabatan Kesihatan Pergigian Populasi dan Pencegahan Klinikal Fakulti Pergigian UiTM. Yang Berusaha Profesor Madya Dr. Budi Aslini Mat Sabri, Pengarah Program Dr. Kesihatan Awam Pergigian Fakulti Pergigian UiTM. Dr. Norbaiti binti Bab, Pengarah Program SMILE 2.0, Rakan Kerjasama Program Kesihatan Pergigian Kementerian Kesihatan Malaysia dan Rakan Kolaborasi Kor Kesihatan Diraja, Persatuan Pakar Kesihatan Awam Pergigian Malaysia, Persatuan Doktor Pergigian Malaysia, Persatuan Pengamal Pergigian Swasta Malaysia, Persatuan Juruterapi Pergigian Malaysia, Kesatuan Pembantu Pembedahan Pergigian Semenanjung Malaysia, Persatuan Pelajar Pergigian Malaysia, Persatuan Pelajar Pergigian UiTM dan Budok serta penaja Colgate-Palmolive Company dan GSK. Panel-panel jemputan, pensyarah-pensyarah Fakulti Pergigian, pakar-pakar dan pegawai pergigian, semua staf sokongan pergigian, tuan-tuan dan puan-puan. Selamat datang ke Majlis Perasmian Program SMILE 2.0 yang merupakan kesinambungan dari program SMILE pada tahun 2021. Setinggi-tinggi kesyukuran kehadrat ilahi kerana di atas limpah dan kurnianya dapat kita sama-sama berkumpul di atas talian bagi menjayakan program pada kali ini. Saya Dr. Raja Nur Adila selaku pengacara majlis pada pagi ini amat mengalu-alukan penyertaan hadirin sekalian. Seperti yang sedia maklum, kita sekarang berada dalam fasa peralihan pandemik ke endemik dan kami berharap anda semua berada di dalam keadaan yang selamat di mana sahaja anda berada. Sesungguhnya penyertaan dan sokongan anda menyemarakkan lagi semangat dan iltizam kami dalam menjayakan program SMILE ini. Majlis diteruskan dengan nyanyian lagu Negaraku dan Wawasan setiap warga UiTM. Hadirin sekalian, bagi memberkati majlis kita pada pagi ini, majlis dengan segala hormatnya mempersilakan Major Dr. Muhammad Arham Hashim untuk mengetuai bacaan doa. Dipersilakan.
Terima kasih pengurusi majlis. Bismillahirrahmanirrahim. Alhamdulillahirrabbilalamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Ya Allah, ya Tuhan kami, hanya padamu sahaja kami panjangkan kesyukuran atas segala rahmat dan berkat-Mu. Bersempena dengan Majlis Perasmian program Smile 2.0, anjuran pelajar pasca siswazah Fakulti Pergigian UiTM Kampus Cawangan Sungai Buloh pada hari ini, kami memohon inayah dan taufik-Mu. Kurniakanlah kesejahteraan dan kebahagiaan kepada kami. Bukakanlah hati-hati kami, lapangkanlah dada kami supaya kami dapat mengisi ilmu dan pengetahuan yang berguna untuk agama, bangsa dan negara kami. Ya Allah, Ya Rahman, Ya Rahim, kami memohon kepadamu agar Engkau berkatilah program Smile 2.0 ini dengan limpahan rahmat-Mu. Semoga segala usaha kami dalam menjayakan program ini mendapat keredaan dan hidayah-Mu. Sesungguhnya, pada hari ini kami berkumpul kerana-Mu, Ya Allah. Kami berkumpul untuk menimba ilmu, bertukar pendapat, menyumbangkan buah fikiran, menghubungkan silaturahim dan memberi sokongan ke arah kesejahteraan semua. Ya Allah. Ya Allah, Ya Zal Jalali wal Ikram, kami memohon kekuatan dari hadrat-Mu, Ya Allah, supaya kami yang hadir pada hari ini, agar kami dapat melaksanakan segala kebajikan, dan kami pohon perlindungan dengan Engkau daripada melakukan keburukan. Ya Allah, kurniakanlah kepada kami kekayaan ilmu pengetahuan dan hiasilah diri kami dengan sifat lemah lembut. Serta muliakanlah kami dengan ketakwaan dan indahkanlah diri kami dengan kesihatan. Rabbana atina fid dunya hasanah wa fil akhirati hasanatan wa qina azaban nar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin.
Amin amin ya rabbal alamin. Terima kasih Major Dr. Muhammad Arham atas bacaan doa sebentar tadi. Semoga majlis kita pada hari ini berjalan lancar dan sempurna hingga ke penghujung acara. Bukan rumput sebarang rumput, rumput penghias tepi halaman. Bukan jemput sebarang jemput, jemput memohon kata aluan. Tanpa melengahkan masa, majlis diteruskan lagi dengan menjemput Yang Berusaha Dr. Nurbaiti binti Bab selaku pengarah program Smile 2.0 untuk menyampaikan ucapan alu-aluan. Majlis dengan segala hormatnya mempersilakan.
Terima kasih Puan Pengerusi Majlis. Yang berbahagia Datuk Dr. Haji Nur Azmi bin Ghazali, Timbalan Menteri Kesihatan 1. Yang berusaha Profesor Madya Dr. Aida Nur Ashikin Abdul Rahman, Dekan Fakulti Pergigian Universiti Teknologi Mara. Yang berusaha Dr. Nur Faizah Mat Buhari, Ketua Jabatan Kesihatan Pergigian Populasi dan Pencegahan Klinikal Universiti Teknologi Mara. Yang berusaha Profesor Madya Dr. Budi Asrini Mat Sabri, Pengarah Program Dr. Kesihatan Awam Pergigian Universiti Teknologi Mara. Rakan-rakan kolaborasi Smile 2.0 iaitu Kor Kesihatan Diraja, Perkhidmatan Pergigian Angkatan Tentera Malaysia, Persatuan Doktor Pergigian Malaysia, Persatuan Pengamal Pergigian Swasta Malaysia, Persatuan Pakar Kesihatan Awam Pergigian Malaysia, Persatuan Juruterapi Pergigian Malaysia, Kesatuan Pembantu Pembedahan Pergigian Semenanjung Malaysia, Persatuan Pelajar Pergigian Malaysia, Persatuan Pelajar Pergigian UiTM dan BUKDOK. Rakan kerjasama Smile 2.0 iaitu Program Kesihatan Pergigian Kementerian Kesihatan Malaysia. Benar-benar jemputan pensyarah-pensyarah Fakulti Pergigian, pakar-pakar dan pegawai pergigian, staf-staf sokongan, sekretariat program, tuan-tuan dan puan-puan sekalian. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera semua. Pertama sekali, syukur kehadrat ilahi yang memberi peluang kepada saya dan pasukan sekretariat lain untuk merealisasikan program Smile 2.0 pada tahun ini. Program Smile 2.0 merupakan kesinambungan daripada program Smile pada tahun lalu, iaitu singkatan kepada Selamat Masyarakat Ideal Lancar Equity. Kali ini, program Smile 2.0 membawakan satu wadah bagi meningkatkan kesedaran kesihatan mental di kalangan masyarakat, khususnya anggota pergigian. Kesudian semua pihak, terutama sekali rakan kolaborasi, rakan kerjasama dan pihak penaja bagi menjayakan program ini amatlah kami hargai. Di samping itu, segala nasihat, bimbingan dan tunjuk ajar dari tenaga pengajar menjadikan kami faham dan mampu merancang program sebegini baik dari aspek isi kandungan maupun teknikal. Bertemakan Mental Health for Dental Wealth, objektif program ini adalah untuk meningkatkan pengetahuan dan kesedaran kesihatan mental di kalangan masyarakat, khususnya anggota pergigian di Malaysia melalui platform laman web, aplikasi mudah alih serta beberapa siri forum dan webinar. Program ini juga memberi pendedahan kepada anggota pergigian tentang impak kesihatan mental kepada kerjaya serta cuba menyelami punca dan cara menangani masalah kesihatan mental. Maklumat, perkongsian ilmu serta pengalaman dari pakar-pakar dalam pelbagai bidang diharap dapat menjadi dorongan dan motivasi kepada anggota pergigian supaya terus berkhidmat dengan cemerlang. Di samping itu, pengisian program Smart 2.0 kali ini juga mempromosikan amalan gaya hidup sihat ke arah mencapai kesejahteraan mental dan kualiti hidup yang lebih baik. Pemahaman yang jelas berkaitan isu kesihatan mental amat penting bagi kita semua agar dapat meningkatkan produktiviti dan kualiti penyampaian perkhidmatan kesihatan kepada masyarakat. Justru kami berharap semua yang terlibat mendapat manfaat dan betul-betul memahami apa yang cuba disampaikan melalui program ini. Seterusnya dapat mengaplikasikan ilmu yang diperoleh dalam kerjaya dan kehidupan seharian. Tuan-tuan dan puan-puan, sekali lagi saya ucapkan setinggi-tinggi penghargaan kepada Fakulti Pergigian UiTM atas peluang dan kepercayaan yang diberikan kepada kami untuk menganjurkan program ini. Terima kasih yang tidak terhingga atas tunjuk ajar semua penasihat program. Terima kasih juga kami ucapkan kepada semua rakan kolaborasi, rakan kerjasama dan pihak penaja yang sudi turut serta dalam menjayakan kempen ini serta kepada semua yang hadir dan memanfaatkan majlis ilmu ini. Akhir kata, saya berharap agar kita semua terus kekal sihat dan selamat dalam tempoh transisi endemik COVID-19 ini dan sentiasa menjaga serta memelihara kesihatan mental. Sekian, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Majlis merakamkan ucapan terima kasih kepada Yang Berusaha Dr. Nurbaiti binti Bab, pengarah program Smart 2.0 di atas ucapan adu-aluan sebentar tadi. Seterusnya, bagi meneruskan acara, majlis dengan segala hormatnya mempersilakan Yang Berbahagia Profesor Madya Dr. Aida Nur Ashikan Abdul Rahman, Dekan Fakulti Pergigian UiTM untuk memberikan ucapan pembukaan. Majlis dengan segala hormatnya mempersilakan.
Yang Berbahagia Datuk Dr. Haji Nur Azmi Ghazali, Timbalan Menteri Kesihatan 1, Kementerian Kesihatan Malaysia. Yang Berusaha Dr. Nur Faizah Ahmad Buhari, Ketua Jabatan Kesihatan Pergigian Populasi dan Pencegahan Klinikal, Fakulti Pergigian UiTM. Yang Berusaha Profesor Maya Dr. Budi Aslini Mat Sabri, Pengarah Program Dr. Kesihatan Awam Pergigian, Fakulti Pergigian UiTM. Dr. Nurbaiti binti Bab, Pengarah Program Smart 2.0, Rakan Kerjasama Program Kesihatan Pergigian KKM dan Rakan Kolaborasi Kor Kesihatan Diraja, Persatuan Pakar Kesihatan Awam Pergigian Malaysia, Persatuan Doktor Pergigian Malaysia, Persatuan Pengamal Pergigian Swasta Malaysia, Persatuan Juruterapi Pergigian Malaysia, Kesatuan Pembantu Pembedahan Pergigian Semenanjung Malaysia, Persatuan Pelajar Pergigian Malaysia, Persatuan Pelajar Pergigian UiTM dan BUKDOK. Panel-panel jemputan, pensyarah-pensyarah Fakulti Pergigian, pakar-pakar dan pegawai pergigian, semua staf sokongan pergigian, tuan-tuan dan puan-puan. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera kepada semua. Terlebih dahulu, saya mengalu-alukan kehadiran semua ke Majlis Perasmian Program SMILE 2022. Seperti mana yang anda semua tahu, kita dalam fasa peralihan dari pandemik ke endemik, di mana kita harus menyesuaikan diri dengan norma baharu ini. Pandemik ini memberi kesan kepada kita semua, sama ada secara langsung ataupun tidak langsung. Antara persoalan yang berbangkit adalah berkaitan kesihatan mental melalui kesan psikologi secara langsung dan akibat ekonomi dan sosial secara jangka panjang. Tuan-tuan dan puan-puan sekalian, menurut laporan daripada Pertubuhan Kesihatan Sedunia, dalam beberapa tahun kebelakangan ini, terdapat peningkatan pengiktirafan tentang pentingnya kesihatan mental dalam mencapai matlamat pembangunan global. Kemurungan adalah salah satu punca utama ketidakupayaan. Dua kajian yang dijalankan pada tahun 2011 dan 2017 menunjukkan pelajar dalam bidang pendidikan kerap mengalami tahap tekanan yang serius serta insiden kemurungan dan kebimbangan yang tinggi. Faktor akademik dan klinikal telah dikenal pasti sebagai punca utama tekanan yang menyumbang kepada masalah ini. Terdapat juga kajian yang menunjukkan pelajar yang dikategorikan sebagai sihat namun berisiko mengalami masalah kesihatan mental kurang mendapatkan rawatan kerana kurangnya kesedaran dan pengetahuan dalam aspek ini. Ini menunjukkan kesihatan mental setiap individu amatlah penting dan perlu dititik beratkan. Hadirin dan hadirat yang saya hormati sekalian, dengan peningkatan kes seperti yang dinyatakan, tema untuk program SMILE 2022 iaitu Mental Health for Dental Wealth menunjukkan kesungguhan pelajar tahun 1 pasca siswazah, Doktor Kesihatan Pergigian Awam dan Pusat Pengajian Kesihatan Mulut Populasi dan Pencegahan Klinikal dalam mengetengahkan isu kesihatan mental di kalangan anggota kesihatan, khususnya pergigian. Walaupun dalam norma baharu, ia tidak menghambat semangat tinggi yang ditunjukkan oleh semua yang terlibat dalam program SMILE 2.0 untuk terus menyebarkan ilmu dan maklumat terkini kepada masyarakat. Golongan profesional dan golongan pelaksana mengikuti saluran yang tepat dan dipercayai. Saya ingin mengucapkan ribuan terima kasih kepada rakan kerjasama dan rakan kolaborasi yang terlibat dalam kempen ini. Ribuan terima kasih juga kepada syarikat Colgate-Palmolive Malaysia dan GSK yang sama-sama menyumbang sebagai penaja bagi program ini. Hadirin sekalian, kempen kesedaran kesihatan mental ini merupakan sebuah modul pembelajaran bagi pelajar doktor kesihatan pergigian awam. Dan saya yakin kempen ini mampu berjalan dengan lancar dan mencapai objektif yang telah ditetapkan. Program ini turut dibantu oleh tenaga pengajar Fakulti Pergigian UiTM Sungai Buloh sebagai penasihat serta maklum balas yang diterima daripada rakan strategik. Program yang bertujuan untuk meningkatkan kesedaran serta berkongsi ilmu dan pengalaman berkaitan kesihatan mental dalam menyampaikan perkhidmatan pergigian di kalangan profesional. Pengurusan kumpulan pelaksana amat diperlukan agar semua sektor terlibat memastikan penyampaian perkhidmatan ke tahap yang lebih tinggi dapat dilaksana. Para hadirin yang dihormati, saya difahamkan siri forum dan webinar pada pagi ini tidak hanya melibatkan anggota kesihatan tetapi turut dihadiri masyarakat umum. Adalah menjadi harapan saya agar para peserta dapat memanfaatkan ilmu yang diperolehi sepanjang program ini dijalankan. Program ini juga diharap dapat menjadi suatu medium kepada orang ramai supaya dapat memastikan masyarakat umumnya mendapat maklumat yang tepat, berkualiti serta dapat bertindak dengan bijak. Masyarakat yang mempunyai status kesihatan mental yang baik akan mendapat sokongan yang diperlukan, akan mampu untuk terus menjaga kesihatan diri, amnya dan kesihatan oral khususnya supaya kualiti kehidupan seorang itu tidak terjejas. Saya percaya kempen sebegini perlu dilakukan secara berkala bagi memastikan semua lapisan baik dari pelaksana maupun pelanggan perkhidmatan kesihatan pergigian dapat mengikuti perkembangan tentang isu-isu semasa khususnya kesihatan mental yang kian diperkatakan. Tuan-tuan dan puan-puan yang dihormati sekalian, tahniah saya ucapkan kepada barisan pelajar pasca siswazah tahun 1 Doktor Kesihatan Pergigian Awam dan Fakulti Pergigian UiTM Sungai Buloh di atas inisiatif penganjuran program ini serta rakan kerjasama, rakan kolaborasi dan penaja-penaja yang turut sama membantu menjayakannya. Saya percaya program ini dapat memberi manfaat kepada seluruh anggota pergigian, khususnya serta masyarakat secara amnya. Saya harap kita boleh bekerjasama lagi di masa akan datang bagi memastikan sektor pergigian sentiasa dalam keadaan yang seimbang dan mempunyai warga kerja yang sejahtera. Ini adalah kerana ianya terbukti dapat membantu meningkatkan mutu kerja dan kehidupan secara umum. Kesedaran dan pengetahuan berkaitan psikologi dan kesejahteraan mental perlu diutamakan dalam mencapai objektif organisasi dan menjana modal insan yang bermutu. Akhir kata, saya berharap program SMILE 2.0 2022 berjalan lancar sepanjang masa dan kita kekal selamat agar kita dapat mencapai kesejahteraan sosial, kefungsian psikologi, kepuasan hidup keseimbangan emosi negatif dan positif. Sekian, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Majlis merakamkan setinggi-tinggi penghargaan dan ucapan terima kasih kepada Yang Berbahagia Profesor Madya Dr. Aida Nur Ashikin Abdul Rahman, Dekan Fakulti Pergigian UiTM, di atas ucapan yang telah disampaikan sebentar tadi. Terbang di awan burung jentayu, di atas papan batang jerami, tampillah tuan kami merayu bersama ucapan kata perasmi. Dengan itu, saya menjemput Yang Berbahagia Datuk Dr. Haji Nur Azmi bin Ghazali, Timbalan Menteri Kesihatan 1 Kementerian Kesihatan Malaysia, bagi menyampaikan ucap tama dan seterusnya merasmikan SMART 2.0 2022 dengan segala hormatnya dijemput.
Yang Berbahagia Profesor Madya Dr. Aida Nur Ashikin Abdul Rahman, Dekan Fakulti Pergigian Universiti Teknologi MARA, Sungai Buloh. Yang Berusaha Dr. Nur Faizah Mat Buhari, Ketua Jabatan Kesihatan Pergigian Populasi dan Pencegahan Klinikal Fakulti Pergigian UiTM. Yang Berusaha Profesor Madya Dr. Budi Aslini Mat Sabri, Pengarah Program Dr. Kesihatan Awam Pergigian Fakulti Pergigian UiTM. Dr. Nurbaiti binti Bab, Pengarah Program SMILE, Rakan Kerjasama Program Kesihatan Pergigian KKM dan Rakan Kolaborasi Kor Kesihatan Diraja, Persatuan Pakar Kesihatan Awam Pergigian Malaysia, Persatuan Doktor Pergigian Malaysia, Persatuan Pengamal Pergigian Swasta Malaysia, Persatuan Juruterapi Pergigian Malaysia, Kesatuan Pembantu Pembedahan Pergigian Semenanjung Malaysia, Persatuan Pelajar Pergigian Malaysia, Persatuan Pelajar Pergigian UiTM dan BUKDOG. Panel-panel jemputan, pensyarah Fakulti Pergigian, pakar-pakar dan pegawai pergigian, semua staf sokongan pergigian, tuan-tuan dan puan-puan. Saya berharap anda semua kekal selamat serta sentiasa peka dan waspada dalam transisi pandemik ke endemik COVID-19 ini. Pada tahun ini, program SMILE 2.0 akan mengetengahkan isu berkaitan kesihatan mental yang bertemakan Mental Health for Dental Wealth. Saya telah dimaklumkan bahawa program ini adalah inisiatif pelajar Doktor Kesihatan Awam Pergigian dari Fakulti Pergigian UiTM Sungai Buloh untuk meningkatkan pengetahuan dan kesedaran kesihatan mental di kalangan anggota pergigian di Malaysia serta masyarakat secara umumnya. Program seperti ini menjadi platform untuk berkongsi ilmu dan pengalaman berkaitan isu semasa bagi menangani masalah kesihatan mental di kalangan profesional pengurusan, kumpulan pelaksana serta masyarakat seterusnya. Ini amat diperlukan bagi memastikan penyampaian perkhidmatan kesihatan yang berkualiti, lestari serta selamat kepada masyarakat. Adalah penting bagi kita untuk mendapatkan kesedaran dan menambahkan pengetahuan dalam aspek penjagaan kesihatan mental agar dapat mewujudkan suasana kerja yang kondusif serta meningkat prestasi kerja dan kualiti kehidupan. Masalah kesihatan mental adalah salah satu punca utama terhadap beban kesihatan global. Kemurungan atau kebimbangan adalah disenaraikan di antara 25 punca utama beban kesihatan di seluruh dunia pada tahun 2019. Pertubuhan Kesihatan Sedunia telah mengisytiharkan global pandemik COVID-19 pada 11 Mac 2020. Rentetan itu, banyak negara telah mengisytiharkan darurat dan ada yang telah melaksanakan dasar kawalan pergerakan dan penutupan penuh sempadan negara bagi mengawal jangkitan virus yang merebak. Ini telah memberi impak yang teruk kepada masyarakat dalam pelbagai aspek kehidupan, ekonomi dan juga sosial. Sistem kesihatan turut terjejas dari segi kapasiti dan sumber manusia dalam memastikan penyampaian kesihatan yang berkualiti tetap diteruskan. Pelaksanaan norma baru seperti sekatan sosial, penutupan sektor pendidikan dan perniagaan, kehilangan pekerjaan dan penurunan aktiviti ekonomi secara tidak langsung mempengaruhi kesihatan mental. Pertubuhan Kesihatan Sedunia telah menetapkan sasaran khusus untuk kesihatan mental melalui Sustainable Development Goals iaitu 34% menjelang tahun 2030 dengan mengurangkan 1/3 kematian pramatang dari penyakit tidak berjangkit melalui pencegahan dan rawatan serta menggalakkan penjagaan kesihatan mental. Tahniah saya ucapkan kepada pelajar Pasar Siswazah Kesihatan Awam Pergigian UiTM di atas inisiatif penganjuran program SMART 2.0 ini. Saya yakin dan percaya program ini akan memberi manfaat kepada profesion pergigian khususnya serta masyarakat secara amnya. Dengan ini, besarlah harapan saya supaya kesihatan mental rakyat Malaysia dapat ditingkatkan dalam menghadapi apapun cabaran yang mendatang. Hadirin dan hadirat sekalian, pada tahun 2019, Tinjauan Kesihatan dan Mobiliti Kebangsaan telah melaporkan prevalence kemurungan di Malaysia adalah 2.3%, iaitu melibatkan hampir 1/2 juta rakyat Malaysia. Apa yang lebih membimbangkan, laporan daripada The Malay Mail pada 11 Jun 2020 menunjukkan 424,000 belia di Malaysia menghadapi masalah kesihatan mental. Laporan tersebut turut menyatakan generasi pada masa hadapan tidak dapat menyumbang kepada negara disebabkan masalah ini, dan ini akan memberi impak yang besar pada sektor sosial dan juga ekonomi negara. Kajian pada tahun 2018 melibatkan pengamal pergigian di Malaysia melaporkan 61.7% mempunyai status kesihatan mental yang baik. Walau bagaimanapun, lebih 30% mengatakan mereka tertekan secara fizikal dan emosi. Di samping itu, aspek kesihatan mental terhadap anggota pergigian sokongan yang lain juga memainkan peranan penting bagi memastikan perkhidmatan pergigian kepada masyarakat dapat diberikan secara komprehensif dan lancar. Oleh itu, kesihatan mental merupakan salah satu aspek penting yang perlu diberi tumpuan supaya anggota yang terlibat dapat menjalankan tugas dengan efisien dan efektif. Hadirin hadirat sekalian, sehingga kini masyarakat Malaysia masih mempunyai persepsi negatif terhadap mereka yang mengalami masalah kesihatan atau penyakit mental. Apa yang lebih membimbangkan, disebabkan stigma sosial ini, hanya 20% rakyat Malaysia yang mengidap penyakit mental mendapatkan bantuan profesional. Ini juga disebabkan kurangnya pengetahuan dan kesedaran tentang penyakit mental serta khidmat bantuan sokongan yang disediakan di negara ini. Dari aspek pekerjaan, persekitaran tempat kerja merupakan salah satu faktor utama yang boleh memberi kesan kepada kesejahteraan mental seseorang. Kajian menunjukkan bahawa majoriti responden percaya masalah kesihatan mental boleh menjadi bertambah buruk secara perlahan dan tidak sedar akibat tekanan kerja yang berpanjangan. Oleh itu, organisasi harus mengutamakan isu kesihatan mental di tempat kerja sebagai komponen penting supaya produktiviti dan prestasi dapat ditingkatkan. Krisis kesihatan mental memberi kesan negatif kepada sistem kesihatan di Malaysia dari pelbagai aspek. Dengan itu, KKM mengambil inisiatif dari pelbagai sektor seperti kerajaan maupun swasta bagi menangani isu ini di kalangan masyarakat Malaysia. Tuan-tuan dan puan-puan, sejak tahun 1997, KKM telah mewujudkan Dasar Kesihatan Mental Kebangsaan. Dasar ini membentangkan strategi dan garis panduan yang menyeluruh untuk menangani isu berkaitan dengan kesihatan mental. Promosi, pencegahan, rawatan dan pemulihan psikososial merangkumi semua program merupakan antara aktiviti yang berkaitan dengan kesihatan mental. KKM telah menubuhkan National Mental Health Registry pada tahun 2003 untuk mengumpul maklumat mengenai pesakit yang mempunyai masalah mental di Malaysia. Terkini, KKM juga sedang membangunkan National Suicide and Fatal Injury Registry Malaysia yang dijangka siap pada tahun 2023. Hadirin hadirat sekalian, untuk maklumat tuan-tuan dan puan-puan, terdapat badan-badan bukan kerajaan atau organisasi swasta yang turut menyediakan rawatan dan bantuan kepada orang ramai seperti Malaysian Mental Health Association, Mental Illness Awareness and Support Association dan banyak lagi. Selain itu, bantuan perkhidmatan kesihatan mental melalui talian turut disediakan bagi memberi bantuan dan sokongan emosi kepada masyarakat Malaysia. Antaranya ialah Befrienders, talian kasih dan talian Buddy Bear. Kempen kesihatan mental juga disambut setiap tahun pada bulan Oktober bagi meningkatkan kesedaran masyarakat. Tuan-tuan dan puan-puan, dengan ini saya menyeru kepada semua agar menjaga kesejahteraan fizikal dan mental melalui pemikiran yang positif dan rasional, membentuk budaya positif untuk meningkat prestasi organisasi, mengurus kewangan secara efektif dan menjaga kesejahteraan sosial melalui perhubungan yang baik serta harmoni dengan orang lain. Sekali lagi, tahniah kepada pelajar Pasca Siswazah Kesihatan Awam Pergigian UiTM atas inisiatif ini. Dalam menganjurkan program SMART 2.0 kepada semua baik daripada sektor pergigian maupun masyarakat, teruslah proaktif dalam berkongsi dan menimba ilmu dalam meningkatkan pengetahuan dan kesedaran dalam aspek kesihatan mental. Jangan malu untuk mendapatkan bantuan, sokongan dan rawatan kesihatan mental di institusi-institusi yang sedia ada. Akhir kata, Dengan lafaz Bismillahirrahmanirrahim, saya dengan ini merasmikan program Smile 2.0 2022.
Hadirin sekalian, dengan itu sempurnalah sudah Majlis Perasmian Program Smile 2.0 kita pada hari ini. Diharapkan si forum pada sesi pagi sebentar tadi dapat memberi manfaat kepada anda semua dalam menambahkan ilmu mengenai kesihatan mental. Oleh yang demikian, kita perlu bersikap prihatin terhadap individu di sekeliling kita dan kepada diri kita sendiri yang mungkin menunjukkan tanda-tanda awal gangguan mental supaya bantuan yang sepatutnya dapat diusahakan. Tumpuan kepada kesihatan mental akan membantu anda untuk menghadapi tekanan kehidupan dengan baik. Sila layari laman web kami www.smileUITM.com untuk mengetahui dengan lebih lanjut mengenai atur cara program Smile 2.0. Nantikan siri forum dan webinar yang menarik yang telah disusun khas untuk anda sepanjang minggu ini. Hadirin yang dihormati, kita telah sampai ke penghujung Majlis Perasmian Program Smile 2.0 dan bagi pihak jawatankuasa, kami ingin merakamkan setinggi-tinggi penghargaan dan jutaan terima kasih kepada Yang Berbahagia Datuk Dr. Haji Nur Azmi bin Ghazali, Timbalan Menteri Kesihatan 1, Kementerian Kesihatan Malaysia di atas kesudian beliau untuk menyempurnakan perasmian program ini dan semua tetamu jemputan kerana telah menjayakan acara hari ini. Tidak dilupakan setinggi-tinggi penghargaan kepada rakan kerjasama serta rakan kolaborasi kami. Kami juga ingin mengucapkan terima kasih kepada penaja kami Colgate-Palmolive Company dan GSK di atas sumbangan anda dan sokongan anda. Merdu bertingkah alunan suara, kadang tak sedar tersilap kata. Andai terlanjur patah bicara, serendah hati kemaafan dipinta. Dan dengan ini saya sudahi. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih.